Good morning, ladies and gentlemen. And perhaps for me, it's to go straight down to the grainy level of things. So I lead the United Nations Population Fund's initiatives on maternal and child health, particularly focusing on the sexual reproductive health and rights. Complex subject, an issue which doesn't find much traction, particularly when you think about the religious community, when you look at it from the cultural dimension. I came to Kenya in 2014, as most of you would know, that Kenya has many challenges, but incredible opportunities. The challenge is that Kenya is amongst the 10 most dangerous places in the world for a woman to give birth. It has one of the highest maternal mortality rates. There are parts of Kenya, such as the county of Mandera, where the maternal mortality rate goes as high as 3,795 per 100,000 live births. Now, when you look at Kenya as a whole, you're looking at 6,000 to 8,000 women dying every year. That's about 20 women dying a day. That's like a bus having an accident at childbirth. So 20% is HIV-related, 50% is hemorrhage-related, and the remaining is hypertension-related. But if you look at it, all of it preventable. But why is this the case? What we found when we carried out an analysis last year was 15 counties of the 47 counties of Kenya contribute to 98% of the maternal deaths. Now that actually shows how stark the iniquity of the health systems were. So what we did was we undertook a journey. We sat down with the 15 county governors as the devolution has taken shape in Kenya, and we got them to actually come together and understand what they were looking at. Many of them didn't even know these statistics, the dire statistics of maternal deaths in their counties. So what we did was we got them to understand it. They were deeply affected by it and signed a communique, a public communique which they are being held to account. And we realized that they just can't do it alone. We needed to bring their parliamentarians. But finally, the most important of this, and this is when I went and visited the Kakuma refugee camp, and I was talking to a South Sudanese refugee woman who'd been raped and pulverized during the war in South Sudan. And I asked her, I said, you know, how do you feel now? Because she'd just been through an SGBV center that UNFPA had set up. And she said, you know, I actually went and tried to get solace from the religious community, the faith leader of my community. And he basically said, this is the stage of a woman. This is your lot. You have to suffer this consequence. Now, that startled me. You know, it really was a startling revelation coming from there. Since I'd opened UNICEF's first office in South Sudan, and today they celebrate their 4th year of independence, how despondent I imagine the South Sudanese community must feel at this moment. What we did was we brought together the religious leaders and faith-based organizations from these 15 counties. Now, that is where I want to go down to the micro level. It was intriguing to see the kind of discussions. First of all, you know, those were voices that remained at the county level. But what was intriguing is once we got them all together, the Christians, the Muslims, all the different denominations that came around the table and the discussions really got started off. What I realized that day, ladies and gentlemen, was that education does not necessarily emancipate us from our deeply entrenched intergenerational views of things. For example, now here are some of the conversations. There was a Christian religious leader who said, to me, I don't agree with women's rights. Women's rights is the equivalent of pro-choice. There was a discussion that broke out between 2 Muslim scholars. One of the scholars ended up saying, I do not agree with the Kenyan constitution of identifying an 18-year-old, anything less than an 18-year-old as a girl child. The Prophet married at the age of 6. He consummated the marriage at the age of 9. As far as I'm concerned, my constitution is the Quran and not the Kenyan constitution. So what has happened is that there is now I want to come to what Catherine wants this discussion to be about, is the interplay between politics and religion. Now, it is clear the Kenyan government has powerful legislations in place on the prevention of female genital mutilation, which is a cultural issue. It kind of crosses the Muslim Christian tribes. Everybody who practices it. It's not unique to one particular religion. And when just asking them this question, it was about keeping the purity of a girl. And in some communities, the practice is from 0 to 3 months. In Samburu County, for example, a girl is cut at the age of 9, and the same day she has to walk to her husband's house, which may be 7, 8, 10 kilometers away, and the marriage is consummated that day. The issue of child marriage. Like I just said, how the Muslim scholars kind of came had different perspectives of it, one opposing the other. But clearly, these were not illiterate people that had sat around the table. It was a revelation for everybody, including people from the office of the president. The president himself had come to open that particular event. It was clear there's a lot of work to be done, because I see them as very powerful change agents. At the community level, they are actually the most direct interface between the rule of law and between faith and everything else. And I just think that these organizations have the power to transform the dire maternal and child health in Kenya. They're a very helpful entity that can help do that. But what we now need to do is to look at how do we have a harmonized education system for them. Because even for the faith leaders, even for these faith-based organizations, if they are going to be dependent on studies that are hundreds of years old, and those are the scriptures that remain current, then we have a problem. Because if I see a cross, and sorry if I'm being provocative, my own religion is Hindu and a range of them, basically religions keep women as underdogs. Until such time, that 50% of the world's population is kept out of the development agenda, kept out of being empowered, kept out in the state of inequality, the world will never progress. Thank you.